Why am I so passionate about lifting the tail in cancer treatment? What do you even mean by that? As an oncologist, I have to read lots of clinical trials. And you, as a patient, might have actually read few clinical trials which are relevant to you. Maybe some of the literature. They give you very broad numbers like median. So median is a very important concept because it leads to all these drug approvals, governments looking at the data, PBS subsidizing. All these things are depending on this median number. Now, what do you mean by the median number? It's a very simple concept. You look at people which is the standard of care, and the new drug. You line up 50 people who had standard of care and compare that 50th person to the 50th person in terms of response who had the treatment. And then you make a comparison. If it is significantly better, then we're pretty happy. The governments, or look at FDA for instance, approves the drug. Normally in a couple of years' time, Australia approves. It has to go through this drug regulated products, but anyway, it gets approved. So we are comparing the median to median. But we're missing the big picture here. What do you mean by lifting the tail is that somebody who actually does clinical trials, actively sort of try to interpret clinical trials for my patients, I look at something underneath that, lift the bonnet and look at the data in a more granular manner. And then you actually realize, here on, median to median comparison is useless because most of the modern drugs are basically targeted treatment. And there is a disproportionate number of people, maybe 15 to 20%, actually get an enormous benefit compared to the median of the standard arm. So that's why most of the oncologists, when I go for these conferences, they actually talk about this concept of lifting the tail. Yes, the median might not be very meaningful, but you might actually get about 10 to 15 or 15 to 20%, which gets an enormous benefit. So whenever I sort of look at the activity of a drug, median, I'm not discarding the median. Absolutely look at that lifting the tail where 10 to 15% or 15 to 20% actually get an enormous benefit. Because if you're in that 1 in 5, I want my patients to be in 1 in 5. In fact, if you can actually look at maybe 4 or 5 targets, your chances of finding the correct drug, which actually works for you, which gives you a disproportionate benefit, you're going to find one. So that's why medical oncologists are very passionate about this concept of lifting the tail, in the sense, is this drug having a disproportionate benefit in about 10 to 20% of the patients. And to find that drug to my patient, he or she gets a maximum benefit out of that. Why this concept is now very important is that when we are actually deviating away from chemotherapy and we are coming to this targeted treatment, more genomic testing, more personalized treatment. And the chances of finding, with the personalized treatment, with these liquid biopsies, with these DNA assays, with doing molecular sequencing, it becomes higher and higher. So we do want to find those group of people who disproportionately benefit. It might be not this drug, it might be drug B, drug C, drug D, something, and which has basically benefits, and make sure that patient lives longer, lives a happier life, less amount of side effects. And this is a real concept here. I want you to basically put faith in the modern medicine, especially oncology care, where the targeted treatment actually does benefit 10 to 15 or 15 to 20% enormously compared to the median. And sometimes the median is not the right measure. That's what I mean by lifting the tail.